we need to differentiate between the T1 and T2 weighted image, and you need to remember 2 key points, and these 2 key points you should remember for your lifetime. So in T1 weighted image, the fat is white, and in T2 weighted image, both fat and water would be white. So this is all about fat and water, and by water we usually refers to the CSF in case of MRI. So the water or CSF, this is the differentiating point. The water or CSF, it would be dark in T1 and it should be bright in T2, and the fat components would be bright or hyperintense or white in both conditions. The two basic types of MRI images are T1 weighted and T2 weighted image, often referred to as T1 and T2 images. The timing of the radiofrequency pulse sequences used to make T1 images results in images that will highlight the fat tissue within the body. The timing of the radiofrequency pulse sequence used to make T2 images results in images which highlight fat and water within the body. So this makes things easy to remember. So in case of T1 image, one tissue type is bright, the fat components, and in T2, 2 tissue types are bright, both fat as well as the water, that is the CSF. So in case of T1, which component would be bright?
Fat.
Yes, the fat components would be bright. And what should be the water or CSF in T1?
Dark.
Yes, it should be dark. And in case of T2, which components are bright?
Both fat and CSF will be bright.
Yes, very good. So both fat and CSF would be bright. So the CSF would be black or dark or hypointense in case of T1. And the CSF would be white or bright or hyperintense in case of T2. So by looking at the CSF, we can easily differentiate whether this is T1 or T2. In a T1 weighted image, the image typically shows fat as bright or hyperintense and water or fluid-filled areas as dark or hypointense. Therefore, anatomical structures with a high fat content, such as adipose tissue, will appear brighter on T1 weighted image, while the fluid-filled structures like the ventricles of the brain and spinal canal containing the CSF will appear as dark. Other fluid-filled areas, such as joined with synovial fluid, the bladder in the pelvis, the gallbladder, common bile duct, the ureter in the abdomen will also appear dark in T1 weighted image. In T2 weighted image, fluid appears bright or hyperintense. Therefore, areas filled with CSF, such as brain's ventricles or the spinal canal, are prominent. Other fluid-filled areas, such as joined with synovial fluid, the bladder in the pelvis, the gallbladder, common bile duct, ureter in the abdomen will also appear bright in T2 weighted image. So they were appearing as dark in T1 and they will appear as bright in T2 weighted image. Also, just memorize this gold standard point. So in general, T1 and T2 weighted sequence images can easily be differentiated by looking the CSF. The CSF is dark in T1 weighted imaging and bright on T2 weighted imaging. So CSF would be dark or black or hypointense in case of T1, and it should be bright or hyperintense or white in case of T2. Also, can anyone explain the T1 weighted, T2 weighted, and FLAIR image with respect to TR and TE? What is meant by TR and what is meant by TE and their importance?
TR means time to repeat and TE means time for equal.
Yes, very good. So TR is the repetition time. Repetition time is the amount of time between the successive pulse sequence applied to the same slice, and TE is the time to echo. T is the time between the delivery of the radiofrequency pulse and the receipt of the echo signal. So depending on the duration of TR and TE, usually the T1, T2, FLAIR, these type of images are introduced or obtained. So in case of T1 weighted image, both TR and TE, both of them should be short. So T1, both TR and TE, both of them should be short. In case of T2, the TR and TE, both of them would be long. And in case of FLAIR image, the TR and TE should be much more long compared to the T2. So it should be shortest. It should be shortest. The TR and TE, it should be short in case of T1. And the unit is usually the millisecond. So in case of T1 weighted image, the TR is usually 500 millisecond and TE is 14 millisecond. And in case of T2, the TR is around 4000 millisecond and TE is 90 millisecond. And in case of FLAIR images, the TR is usually 9000 millisecond and TE is around 114 millisecond. And the FLAIR image, FLAIR means the fluid attenuated inversion recovery. The FLAIR image is also similar to the T2 weighted image, but TE and TR, they should be much more longer compared to the T2. And there is another condition. Often you encounter the MRI with gadolinium contrast. So in case of gadolinium contrast, the T1 weighted imaging can also be performed while doing the infusion of the gadolinium. The gadolinium is the non-toxic paramagnetic contrast enhancement agent. So when injecting the gadolinium during the scan, the gadolinium changes signal intensities by shortening the T1. So the gadolinium would be very bright on T1 weighted image, and gadolinium enhances the images that are especially useful in looking at the vascular structures and breakdown of the blood-brain barriers like the tumors, abscess, inflammation, especially the herpes simplex encephalitis as well as the multiple sclerosis. So in case of herpes simplex encephalitis and multiple sclerosis, we usually go with the MRI with gadolinium contrast, and in that case we use the T1 weighted imaging. There is another terminology known as the DWI, diffusion weighted imaging. So the DWI, this is designed to detect the random movements of water protons. The water molecules, they diffuse relatively freely in the extracellular space, and their movement is significantly restricted in the intracellular space. So they will move freely in the extracellular space, but the movement of water molecules, they are restricted within the intracellular space. And this diffusion is also known as the spontaneous movement. This diffusion or spontaneous movement, they become restricted in case of ischemic brain tissue. During the ischemia, the sodium potassium pump shuts down and the sodium accumulation occurs intracellularly. So water then shifts from the extracellular space into the extracellular from the extracellular space into the intracellular space due to the osmotic gradient. So as the water movement become restricted intracellularly, this results in an extremely bright signal on the DWI. So DWI is an extremely sensitive for detection of acute stroke, especially the acute ischemic stroke. So if you want to remember one thing with regards to DWI, remember this is extremely sensitive in the detection of acute ischemic stroke. Other than acute ischemic stroke or cerebral ischemia, it is also useful in the for detection of characterization in the tumors. But if you want to remember one thing, remember that DWI is extremely sensitive in case of acute ischemic stroke. So here is the link, most probably from the Radiopedia. So you can just go for the self-reading with respect to the MRI sequence by opening this link. So the T1 weighted image, it can be further subdivided into gadolinium enhanced, fat suppressed. So gadolinium enhanced, this is commonly done in case of T1 weighted image, and fat suppressed, this is done both in T1 as well as T2. And there are some others like proton density, DWI flow sensitive, as well as the MR cholangiopancreatography. But just go through the T1 weighted, T2 weighted, and the FLAIR image. So next one is the chart. The T1 and T2 MRI images appearance of various structures in the brain, and you need to memorize this chart for proper diagnosis. So what should be the color of fat component in T1